Hello. I imagine we still have some people logging in. Welcome to Battling Burnout During a Crisis. Hello. I'm just waiting a few minutes for everyone to get in here. All right. Today kicks off our Nursing Week webinar series, Storytelling and Self-Care That Every Nurse Needs. So I'm very excited. We appreciate our healthcare workers and know they have endured so many trials this past year. We thank you and hope you will leave here today with some invaluable tips on self-care and taking care of yourself. So I'm very excited. We appreciate your passion and kindness and what you do every single day again. And before we begin, I will briefly highlight the opportunities available for continuing education in the nursing arena. And then I will introduce our wonderful guest, Dr. Brooks. Okay. And I'm going to just share my screen for one moment here. All right. With 5-week-long classes and a generous transfer policy, our RN to BSN is a way to transition to your BSN faster. Those transferring with an associate's degree in nursing can complete the program in as little as 14 months. Students can be awarded 87 credits for their ADN with an RN license, leaving as little as 33 credits or just 11 core courses to complete your BSN degree. We also offer our competency-based RN to BSN, which can be completed in less than a year and for under $10,000. So that's our RN to BSN. We have 4 areas of concentration for our MSN. We have our family nurse practitioner, administration, which you see here, education, and informatics, nursing informatics. Our MSN courses are just 6 weeks long, and there's roughly 12 courses. Some programs may not be available in every state. And I also just wanted to mention very quickly that we will be recording this event today so that we can share it with the other nurses who weren't able to attend. Thank you. Doctor of Nursing practice. This is your terminal nursing degree. You ever want to have doctor after your name, like Dr. Brooks? So this is for nurses who who require it for advanced practice. The courses are just 8 weeks each, and there are 11 core courses for the DNP. You can begin your applied project in your first course and follow a schedule of milestones throughout the program. All right. And that will leave us with our final slide here. We will be putting in the chat box today. Our lovely moderator, Danielle Sullivan, will be answering questions for everyone. But we will be putting in the chat box a link. For some reason, I'm not seeing the barcode pop up. So what we will do is put a link. So if anyone would like more information, I know when you signed up for the webinar, they asked you if you would like more information. So please feel free to talk to admissions rep. We have many other programs like our healthcare management, graduate certificates, and again, with Career Support for Life, a free application. It's a great time to get more information for our nurses. So I am going to stop sharing here. Bring us back. Welcome back. All right. So I would like to introduce Dr. Brooks. And I'd also like to thank again Craig Radell, Market Director, and Danielle Sullivan, Market Services, today for helping out. Dr. Brooks is the Associate Dean of Undergraduate and Master's Non-FNP Nursing programs here at University of Phoenix. As a researcher, she studied the long-term outcomes of weight regain in bariatric surgery population. She has several publications in the area, in the areas of critical care and nursing education. Completing a Master's of Science in Nursing in 2000, she went on to complete her PhD in 2018 from the University of San Diego. Dr. Brooks has been on the front lines of the pandemic of SARS. So she knows what it's like to have stress and trauma during a pandemic. So she brings us some great knowledge. Dr. Brooks practiced extensively in ISU, critical care. She was a Doris Howell Scholar, and she does so much for the impact. She does so much for the community and helping women's rights and advocacy. So I am so pleased to have her here today. She has been with me on a couple of different webinars. She just brings a positive glow, and I know all of the nurses appreciate it when she can speak for us. So I thank you so much, Dr. Brooks, and I'm going to let you go ahead and share your screen.
Thank you, Ava, and thank you, team, for being here this morning for this event, and it's an honor. So I'm going to jump right in and share my screen. And let's put it in this mode here. Okay, how's it looking?
It looks good.
Okay, excellent. Thank you, everybody. It's an honor to be here. And as Ava shared, I've been a registered nurse since 1993. And during the late 1990s, early 2000s, I served 17 years at the bedside. And I was serving in a University Medical Center in downtown San Diego during the SARS crisis, which, as you all know, is the cousin of COVID, or has evolved into COVID. And so it was, to this day, I do believe that, you know, there are some after effects of PTSD a little bit from having served in that space. And hopefully today I'll be able to share with you my experience and how to really support yourself and your colleagues. And happy Nurses Week, by the way, to all my colleagues out there who appreciate the hustle and embrace the grind. Thank you for all you do. So today we're going to be looking at three things that we'd like for you to take away with you and bring into your practice. We'd like to look at figuring out what are common reactions to fatigue and stress at the bedside, especially during crisis, such as the one we're experiencing today. Identifying signs and symptoms on how to recognize that fatigue and burnout to stop that from happening or prevent it, be more preventative, especially during our shift fatigue problems. And describe effective measures for prevention of fatigue. And I'm just going to have a sidebar. This is more of a storytelling for me. So I wanted to share with you that I recall after working 4 12-hour shifts straight, you know, you get the phone call from your manager that says, "Hey, Ray, you know, we're paying about $100 an hour tonight if you want to come in for time and a half." And this was back in the late 90s. So you can imagine. But at some point in time, you know, first couple times I was like, yeah, sure, I'm on board. But after a while, you know, after the fatigue and after not being able sometimes to you know, feel like I was fully engaged and fully there for my patient, I had to start saying no. And that's part of some of the tips we're going to share with you today. So what you're seeing is the reality of nursing in our present day. Oftentimes, as nurses, you know, we are expecting to do wonderful things, and we do, absolutely do. But it's not always daisies and roses, right? There's fatigue is real, burnout is real, mental health is real, stressor is real, and I want you to feel that it is normal. Given the day and age, I want you to understand that we need to make an effort to bring this forward and to normalize this. You are not alone. You are not alone. So this is what we truly experience on a day-to-day basis. And this is what we really signed up for, right? We signed up to make a difference because we love to care and we are passionate about making a difference in people's lives. And as you know, nurses are in the unique position to help support someone's very first breath as they come into this world at birth and support their very last breath as they exit this world. So the job we do is extremely important, and this is what we'd like it to be every single day. So let's dive into nursing fatigue. It is multifactorial. It's like an onion with many, many layers. And this is not limited, right? This list that you see in front of you, oftentimes, especially during this pandemic, short staff, right? There was a huge upscaling of skill to the critical care units for nurses to be able to care for the critically ill, especially with the advanced respiratory distress syndrome that happens as a result, and critical care needed to support COVID, advanced COVID. Charge nurses are demonstrating a high level of anxiety and stress, right? They're getting the calls from the ER, find me a bed, I need a bed. The doctor's calling the charge nurse, I need a bed, make space, discharge whoever you need to discharge, give me that space, I need to admit this patient. For support at home at work, right? How many nurses had to actually isolate themselves for purposes of not spreading COVID, so there's isolation and not that it was purposeful, but perhaps there's no support there because you're having to go home, and be by yourself and not being able to decompress effectively. Not enough information provided regarding staffing or changes in the policy. So one day a policy is one way and the next day it's another. Other departments lacking communication between team members. So a great example of that is I remember times when I would call and say, hey, is my unit of packed red blood cells ready yet? And they say, well, when did you put that order? Right? No blames, no pointing fingers, but there's a lack in communication. Perhaps it's even our system, right? On how the computer systems and how we're communicating with each other. Nurses can't even take a break. I remember working the night shift, 7 p.m. to 7 a.m. and having this full bladder filled with 5 cups of coffee. And my patient's heart rate is 170, atrial tachycardia, and I am afraid to go use the bathroom because the other nurses, my other colleagues, have just as critical a patient that they're caring for. Crossing professional boundaries. So as the stress rises, the fatigue rises, bullying, lateral violence, and incivility are real. So again, this is not a limiting list. So right now, with all that said, and that list of lots of fatigue out there and reasons why, layers of the onion, in the chat, I want you to take a moment and share some attitudes that you have experienced or witnessed demonstrate fatigue and burnout. And so let's take a couple minutes in the chat. Be bold, be brave. It's your week, Nurses Week. Help me out. What have you experienced? And I'm going to ask Danielle and Ava to help me out as the chat starts to populate.
All right, I see. Seen as weakness, should overcome by being stronger.
That's a great point. Culturally, I was taught growing up that, if you complain and you're whining about the job that needs to get done, that is not acceptable. And so I would have this stoic, very, very straight face coming in, especially towards the end of my shift. So that's a great point.
The chat's kind of quiet.
Okay, thank you for sharing, whoever the brave person was. I appreciate that.
Short fuses?
Absolutely, absolutely. I remember, needing to turn my patient. You've got a patient on a ventilator. They're basically being induced into a coma to preserve oxygenation. And the patient is, on their back, and I need to turn them every 2 hours. And I'm looking around going, where is everybody? I need help here. I can't turn my patient on my own. And I remember getting extremely frustrated really quickly when I looked down the hall and there's no one to be seen or found.
Mm-hmm. Next comment, feeling helpless and hopeless.
Absolutely. Absolutely. Helpless and hopeless. Those are really, I would like to validate validate that, especially at the end of your shift, and feeling like, what is it that I could have done better? I remember many a day driving home after my 12-hour shift, which turned out to be 13 or 14 hours because of the documentation that has to happen after your shift is ended, right? And you had a code blue at 7 a.m. as you were getting off. And I remember driving home and thinking and feeling helpless or hopeless and saying to myself, what could I have done better as a nurse for that patient?
Dealing with demanding family members of patients.
Absolutely, absolutely. As nurses, we are caring holistically for our patients, right? We're caring for not only the individual that's in that bed, that's vulnerable, that needs our care, but also the helpless family members who are on that journey with them. They're just as vulnerable. And it is also, we are case managers, right? We are case managers as nurses. We are psychotherapists as nurses. We are janitors. We are engineers and troubleshooting our machines. And at the very most important role is helping to communicate and bridge that communication between families and the practitioner that's actually, caring for the patient. Okay, I'm going to move forward to the next slide. If there are any more, please feel free to stop, Danielle, and add in.
Absolutely.
Okay, thank you. So reactions, let's talk about reactions to fatigue. Let's dive in a little deeper. So physically, we are exhausted, you're having some emotional fatigue, and that really undermines a person's ability to feel positive about what you're doing. It can stem from always being on, right? 24/7. And even when you go home, right, you still have family members as well that are expecting you to educate them. That's the privilege that we get as nurses. Everybody counts on us to help. It's what we do. You're under intense time pressure, too much to do, and perhaps maybe not even having the skills to accomplish it. I can't tell you how many times back in the late 90s where I was floated, right? I'm a surgical ICU and trauma nurse, and they floated me down to OB. What do I know about female women's health? I didn't. And unfortunately, the patient I was caring for at the time was a 16-year-old patient who had a placenta previa and abruptio. So the placenta, as she was giving birth at 16, started ripping away from the uterus wall early, and she was bleeding. So the patient essentially was a trauma patient, which was my expertise. So, but I remember thinking, as the OB-GYN walked in, the OB-GYN asked me, "Nurse, did you check the fundus?" And I thought to myself, I just looked at him, I said, "What's a fundus?" And a fundus is, doing a vaginal check to see, if the uterus is now contracted and becoming strong so the bleeding would stop. So in that case, I definitely felt like I did not have the necessary skill to accomplish my job. Cynicism, depersonalization. I remember how many New Year's Eve did I work? And it was the year 2000. We had a running bet. How many motor vehicle accidents? Let's have a pot here. Let's start taking a pot here. Who wants to put a dollar in the pot? How many do you guess? How many motor vehicle accidents? How many of those do you think are going to be drunk drivers? And that's very cynical, but it's true. It's the reality. It's ways that we're coping, right? And I never won that pot, by the way. One of the nurses did. He was really quite good at guessing. Inefficacy. This is a fancy word that just means lack of confidence. Efficacy, self-efficacy is a fancy term. It's a concept that says that we have the confidence to accomplish what we need to accomplish. In this case, inefficacy, because of burnout and fatigue, is incompetence and feeling like you're not able to succeed at what you need to succeed at. And our patients are depending on us. So we'll pause here because we're going to yawn and take in our oxygen and remember that at the end of the day, nurses, colleagues, you are the most trusted profession in this nation. I think there was only a couple of years where we were knocked off that first ring, according to Press Ganey survey, surveying thousands of Americans in this country. It was when 9/11 hit and firemen actually rose to the top of that list. Other than that, we have been on the top #1 spot. Nurses, we are the most trusted profession. And from the minute we enter our patient's room to the minute we leave that patient's room, we are being scrutinized and watched. You have the privilege of caring for a patient at their most vulnerable moment. Again, from the very first breath on this earth to their very last breath on this earth. It is your privilege. It is our privilege. Know that we are being observed, so we don't have time to show fatigue or burnout. We are expected to be present every minute we are with our patient.
I have a few comments in the chat, Dr. Brooks.
Please share, Danielle.
Even in the face of exhaustion, nurses will push on because they know the patients need them, especially in crisis situations. And nurses represent the best of humanity for a variety of reasons. Made my recent knee replacement tolerable.
Oh, thank you for sharing. Amen to that. Thank you for sharing. Absolutely. You are capable of remarkable things. And oftentimes we lose our why. And during burnout and fatigue, it's easy, it's human nature. And I want to validate you and understand that it's true, we can lose our why. And I'm here to share with you that maybe the journey isn't so much about becoming anything when you became a nurse. Maybe it's about unbecoming everything that really isn't you, so you can be what you were meant to be in the first place. Rediscovering your passion and your why is extremely important. And this is a picture of my father. He is a veteran. He served 30 years in the US Navy in our country, including in the Vietnam War. And this is my grandson. He's 2 and he's a firecracker. And if you're not willing to learn, no one can help you. If you are determined to learn, no one can stop you. And during our time, at the moment of our fatigue and our burnout, this was my why. I wanted to make a difference. I knew I wanted to become a nurse because I wanted to be able to care for my father, who, by the way, had asbestos exposure and has lung issues because of serving 30 years down in the engine room of a big carrier for 30 years. And back then, the Navy did not know that asbestos was cancer causing. And they put it in the walls, and he was in the engine room, which unfortunately is at the very, very bottom deck of the boat, of the ship, those Navy vessel ships, the fighter ships, carriers that carried all the airplanes to launch off and to fight. So he and my grandson are the why. And it's important for us to find that compass, to navigate back to our why, to help us. And you're right. So whoever shared that, we push forward. Caring and service at the end of the day. That's truly what our profession is all about. I love this quote: grant me the strength to focus this week, to be mindful and present, to serve with excellence, and to be a force of love. More quotes of excellence. Excellence in our daily practice. So excellence is an art won by training and habituation. We do not act rightly because we have virtue or excellence, but rather have those because we have acted rightly. We are what we repeatedly do. Excellence then is not an act, but a habit. And I remember as a brand new nurse coming onto the floor, my first job actually was in a skilled nursing facility. I was a certified nursing assistant for 6 years. Before becoming a registered nurse, I completed an associate degree at a community college in San Diego, and that was my very first degree. And I'm proud of it. And I remember my very first critical care job was a telemetry unit, and I would come onto the unit, and I loved seeing there were certain nurses that I just loved seeing because they were my role models. No matter how busy or short-staffed we were, they would be smiling. They were always willing to help, very kind and generous and giving of their time to patients and families. And I remember specifically, and her name was Ava. Her name was Ava. Oh, Ava. I know. And I called her Manang Ava because she was, that's a sign of respect. And I, you know, in passing, I'd always call her Manang Ava because it was a sign of respect in my culture. And I say, hi, Manang Ava, good evening. And I remember passing by and the curtain was drawn and I kind of paused and I stopped, and it was Manang Ava talking to her patients and the families. And she said to them, can I get you anything else? Because I have the time. Knowing she had 6 other patients waiting for her. But I love that. And I thought, oh my goodness, what a wonderful thing to say to families and patients, especially, you know, with this patient being so sick. And I used that. I learned that, I assimilated that, and I used that statement every single time because I didn't ever want my families and my patients' families to feel like I was in a rush to get to my next patient. I was present, and I love that fact about, you know, making sure that we're present with our patients and to let them know that. And what better way, right? Can I help you can I get you anything else? Because I have the time. Let's shift and let's talk about preventing fatigue. So take charge of your practice. You're a team member, but you are also a leader in the space. People are watching you, whether it be your patient's families, your patient, your colleagues, your fellow coworkers, your staff nurses that work with you. And to develop a role model mindset. So take a minute and ask yourself these difficult questions. How am I portraying myself to my peers and coworkers when I experience fatigue? Now, again, we're only human. So I want you to also be forgiving of yourself. Am I being a good role model to other nurses and team members I work with? And how am I portraying myself to my patients and their families? Do I really know the stakeholders that need me to bring my A game? In other words, do I really know that they are depending on me? My team's depending on me, my patient and their families depending on me to bring my A game. Give yourself permission to be vulnerable. This one is a very, very difficult one for me because, again, in my culture, it's all about being strong and being just pushing forward. But we're only human, and I'm here to normalize and share that it's normal to feel like, sorry, that was my alarm telling me to hurry up, move it on, move forward. Apologize. But I'm here to share and validate that it is normal. During this pandemic crisis, it is normal to feel helpless, to feel hopeless. And we need to validate that and support each other. And I love this analogy. This is another one that I heard from a wonderful role model nurse. She said, I need you all to lean in. I need you all to lean in. We need to get through this shift. We got people lined up waiting for these beds. Every single one of you has an admission. I need you all to lean in. So ask yourself, do I openly share that I'm experiencing a high level of fatigue, anxiety, or stress? Do I openly ask for help and seek clarification and guidance if I don't understand the outcome? Doctor, what's a fundus, right? I remember the OBGYN when he asked me if I checked the fundus, what's the fundus? So ask, right? Ask your questions, seek clarification if you don't understand. Do I demonstrate the courage to call out others who are impacting my stress? Look, lab, I appreciate that you're getting the blood ready. And I just want you to know I have a patient that's lost 4 liters of blood and we're waiting on that blood. So if you could please put a stat on that unit of blood waiting, and I'll be right down to pick it up as soon as you're ready. Please let me know. Prevent compassion fatigue. Identify your support people at work. So Manang Eva was a wonderful example. Remember, this is my 20-year-old self, right? This was my 20-year-old self. I was a new nurse on a telemetry floor cardiac unit. And Manang Eva, she was a very seasoned veteran nurse. And despite that, she did not one day ever exhibit burnout or fatigue. Sure, there were times when she was a little stressed out, as we all were at, anytime you had a busy shift, but she was always professional, extremely professional. And she was my support, anytime I had to debrief. Identify professional development opportunities. There's wonderful opportunities to be able to identify what it is you need. Always be willing to learn, be an open book, and go seek out opportunities that will help you decompress, de-stress, that'll help you to be able to lean in and support one another. Set professional boundaries. Look, I just received an admission. Is there anyone else that can take this admission? This patient is extremely unstable. I don't have the capacity or the work bandwidth to support this patient, and I want to do my best and be my best for this patient. Find someone else. Can you call someone in? So set your professional boundaries. Debrief. Again, in that break room, Manang Eva was my rock, my husband at the end of the day. I didn't have to tell him a patient's name, but I can certainly express to him all of my stress and anxiety that I had during that shift. He is an honorary nurse, by the way, for listening to me debrief for 28 years. Mentoring. If you are the Manang Eva, you need to identify nurses and lean in who are struggling. Be mentors. It's not about saying, look at me. It's about, how can I help you be the best you can be? This is what I found to be helpful for me. Let me share it with you. Strong nursing leadership. Again, look around. Who is it? Who are your role models? If there are none, then you become one. Become one. Again, it's in the habits that we do every day. And self-care, finally, take care of your own self. We're the worst. Nurses are the worst. We want to care for everybody else. And in the meantime, we're not caring for ourselves. Take your breaks. Stay hydrated. Don't be the 5-cup of coffee nurse, especially at the end of your shift when you know that you have to come back that very next night. Cut it off at 4 a.m. or cut it off at 4 p.m. at the end of your shift so you can get a good night's sleep, right? Take time to talk to your family and talk to a friend. Again, you don't have to disclose all the details of your work, but certainly at the core essence of being vulnerable, you need that support and you need someone to listen. Master your sleep schedule. Know that, close the blinds. If you work the night shift, use some blackout curtains, right? Again, milk used to help me sleep. So I would down a couple glasses of milk. Take a hot shower, warm bath to help your muscles relax, especially if they're all the way up by your ears from working, that code blue that happened at 6:30, code blue, bed 5, ICU bed 5. Oh, that's my patient as I'm sitting there documenting. Oh my goodness. So jumping across the nurse, I can't remember, but the running around the nursing documentation wall that, you stand there and you document, and for one second that you go to sit down, your patient codes, right? So you're going to need that relaxation in that bath. Eat a high protein meal, because that also research is sharing that right before bed, milk, for example, will help promote sleep. These are some fun ways to help yourself. Take a walk, have a lot of green, flowers, talk to a friend, set priorities, play with your pet. Pets are wonderful. Listen to some music that really changes instantly your catecholamines, and you provide some really wonderful dopamine, right, to help relax and have well-being, those hormones and neurotransmitters. Read a book. Exercise is a great one, but not before you go to sleep, because that gives you fitful sleep. Maybe even before you work, your shift starts. So this time, I want to thank you, nurses and healthcare partners, for all you do. It's been an honor and a privilege, and happy Nurses Week. Celebrate you. I'm going to stop here. I'd like to take a moment to be able to have our participants share some thoughts and things that they do that are effective, because we all hear some wonderful tips that you're all doing that are helping you with your stress fatigue, or helping you to get some rest and sleep.
Yes, I have some great comments here in the chat. Nurses are respected and trusted because they almost always put their patients' needs first, rather than serving the interest of the medical groups or insurance companies.
Absolutely.
Someone also posted, it looks like an article, nurses are the backbone of healthcare and what COVID-19 has taught us about nursing. Someone mentions that she's Filipino and she is your Ava to the younger nurses, so she appreciates your cultural reference.
I love it.
And that's all I have in the chat for now.
Awesome. Thank you
That's
so
so
much,
wonderful.
Dr. Brooks. Thank you, Danielle. This was just so inspirational. And I know we have 3 more coming up of our webinars. So I'm very excited for Male Nurses Bridging the Gap, Mindful Meditation. We have 2 versions of that with Kristen Griffin and Christopher Dennis. So just a whole exciting jam-packed week for us, for our nurses, in appreciation and tribute. And again, if anyone wants more information about nursing degree options, that's in the chat. And I believe we'll also throw in the, thank you, Danielle, to register for additional webinars. We have them going on all week. So we thank you all for joining us. And again, if anyone wants to reach out to us, please do. Any questions for Dr. Brooks as well, we'll have her email information as well.
We do have some time, Ava, if you want me to hang out just for a few more minutes. I'm happy to do that.
Yeah. Do we have any more questions from the chat, Danielle, coming through?
Nothing at this moment in the chat.
Okay. And did we have any questions about any of the nursing degree options while we're here? RN to BSN, MSN, doctoral. Do we have any questions about ways to cope and manage stress during this crisis? I know the pandemic is lifting up, right? Vaccinations are clearing up. This pandemic hopefully very shortly. I know every state's a little bit different with that. I'm not seeing any more questions unless you are, Danielle.
No, I don't see anything either.
I'll share one last story. And this is hopefully going to be an inspiring one for you, because it certainly was for me. And I remember in the early 2000s, this patient actually came in young, and he was a doctor. He actually served at the VA hospital across the street from UCSD Medical Center, where I was the trauma nurse. And I got the call from ER saying, look, we got to admit this patient. He's a doctor across the street, and he's short of breath, and we can't figure out what's going on. And of course, it was SARS. We didn't know it was at the time, but it was SARS. But by the time we figured it out, the patient, I'm going to refer to him as a patient now, because, you take away all those roles and titles. At the end of the day, they're the patient. And I remember, he was sitting up, and he wouldn't let me lie him down when they wheeled him in the gurney into the ICU. And he would not lie down flat because his lungs are filling up, and the x-ray showed whiteout, meaning there was no oxygen exchange. And I knew he was going to get intubated and put on a ventilator because his arterial blood gases were horrible. Despite being 100% oxygen FiO2, his oxygenation PCO2 kept rising and his oxygenation kept dropping on the arterial blood gas. And long story short, he ended up on full life support, 1 month in the ICU, not only on full life support, but the minute we intubated him, the team, respiratory therapist, the pulmonologist, myself as ICU nurse, he dropped his blood pressure. And so he was on full vasopressors and ended up on renal failure. So was on 24-hour dialysis, CVVHD at the bedside, and his lungs were still not perfusing. So we ended up reversing him and forcing oxygen time cycle on the ventilator. He ended up also having ECMO, which is the same machine that we use for heart-lung bypass during heart transplants, open heart surgeries, lung transplant surgeries. It's a machine that oxygenates the blood outside of the body while the lungs or the hearts is not working. And he was on ECMO, CVVHD, which is the renal dialysis, and full pressors and time cycle on the ventilator. And I remember at the time, thank God he was a one-on-one. So I was the nurse running all those machines. Thank goodness, not the ECMO in the state of California. We have perfusionists that can run the ECMO, but oftentimes across the nation, I'm hearing that because of this COVID, this very same reason, nurses are running the ECMO machine, the CVVHD, the multiple pressors, and the ventilator, the drips. And you can imagine the spaghetti of IV lines coming to the patient's neck. The patient's completely comatose on purpose, so their body and their muscles not using any oxygen. And we're trying to preserve it for all the major organs, the brain, the heart, the lungs, the kidneys, the liver. And in the month that he spent there, I must have cared for him at least twice a week during my 12-hour shifts. And he got better. He actually became extubated, not without losing a lot of muscle mass, a lot of weight, and was transferred to a step-down ICU floor. And I never really knew what happened. I suspect that he, being a 30-year-old, strong, healthy patient, that he was going to recover, not without some residual lung issues, scarring of the lungs and being on steroids and an inhaler, probably lifelong, and muscle atrophy. So he would probably have to re-engage those muscles, get a lot of physical therapy. But a couple months later, this very handsome gentleman with a cane walks in, and he's got this huge basket of Godiva chocolate and pink scrub tops, like rolled up in this huge basket. And it was so cool. And I said, "Oh, that is so nice. Hi, my name is Ray. This is so nice. How?" And he said, "Oh yeah, I was a patient here." "Oh, you were?" And he said his name. And I said, "Oh my goodness, I'm so thankful you came back. Thank you for letting us know that you're doing well." Because in the ICU, you never see them. You transfer them over and you just assume that they do well. You never see them discharge home, right? They don't go from ICU to home. They go from ICU to lower care. So that made my day, and I'll never forget that. And my understanding is that he's back to his normal practice, not in the ER anymore though, because that's where he actually got the exposure to a patient because he was an ER nurse in the VA, ER doctor in the VA.
That's a great story. Those are the stories every nurse probably cherishes, right? Yes, I mean, they have gotten us through this pandemic, and we truly do appreciate all nurses. I know it's been a difficult year for everybody, but especially for our healthcare heroes. And I'm just so amazed at the inspiration you brought to us today, Dr. Brooks. We truly appreciate this. And
I'm amazed at my colleagues, my fellow nurses, I appreciate the hustle, and I am so thankful to them for appreciating the hustle and embracing the grind. I feel you out there. I feel you, and I see you.
We appreciate you all, and thank you all for joining us for battling burnout during a crisis. We certainly would love to see you at our next 3 series. So please do check that out, and happy Nurses Week.
Happy Nurses Week.
Okay, we appreciate you.
Thank you, everybody.
Bye.